Hi, I'm Matea Yoakum with Ignite Insurance Group, and today we're going to talk about the difference between a Medicare Supplement versus a Medicare Advantage Plan. That's a very important question that I get asked often as a Medicare insurance broker. What's the difference and which way should I go? So I hope this video will be helpful to you. So initially, when we get into Medicare, we receive our red, white, and blue Medicare card issued by the federal government. It should reflect both Part A of Medicare, which is our hospitalization benefit, and it should also reflect Part B, which is the outpatient and physician side. This allows us to be seen by doctors and specialists all throughout the nation. So if you have that card with both Part A and Part B on it, that would make you eligible for either a supplement or an Advantage plan, either way. Please keep in mind that the premium that you are paying to the federal government, if you're drawing on Social Security, it would be coming out automatically. That premium is based on your income. And if you're not drawing on Social Security, that would be billed to you quarterly. If you are paying some type of premium, that would stay the same. So keep in mind, regardless of whether you opt into a supplement or an Advantage plan, that Part B premium will stay in place, and that will be something that you continue to pay, okay? So option number one would be the traditional Medicare route, which is also known as Medicare being primary. And Medicare Supplement Insurance Plan is also known as a Medigap plan. With these plans, they have letters involved, A through N. Each letter will have a different standardized nationally. They're going to be, the coverages are standardized, which can make it real easy when you're deciding on which insurance carrier to go with. So these are the lettered policies, A through N. So let's say that you choose an option, a lettered option, you would pay a monthly plan premium in addition to your Part B premium, and you would pay that premium every month. Okay. The nice part about a Medicare supplement is typically when you're paying that premium, there's little to nothing else that would come out of your pocket if and when you see a doctor or if and when you have a medical service performed. As long as you pay that premium, your coverage will stay in place, and the copays and deductibles and coinsurances are typically paid by the supplement plan or by that lettered plan. So these plans can work really well for people who need a lot of flexibility. They are national plans, so as long as the providers that you wish to see are willing to accept Medicare assignment, meaning that Medicare would be primary and they're willing to assume that cost, then you would be able to see them without a referral, without any network restrictions or limitations. Also, keep in mind that Medicare Part D for prescription drugs is not included. So that would come at an additional monthly plan premium to pick up a prescription drug plan. Medicare supplements typically travel with you. So if you do go to another state and need coverage or services available to you in a different state, that should work very well for you. They do travel over state lines. So depending on how often you see your doctors and any sort of medical services that you might foresee going into the next 12 months, that would be something to take into consideration before opting into any plan. So the supplements can have a higher cost with the monthly plan premium, but if it's being utilized, that can be a really great option for someone because the out-of-pocket costs are very minimal and very predictable. So the alternative is a Medicare Advantage plan, or option number two. Medicare Advantage is also known as Part C. So with the Medicare Advantage plan, these are administered through private insurance carriers. Companies like United Healthcare or Humana or Anthem Blue Cross Blue Shield. They're provided by a number of different carriers nationwide. With that said, the insurance carrier would then become the primary insurance instead of Medicare. Medicare never goes away. Medicare is something that you've earned and you've paid into. But when you have a Medicare Advantage plan, the health plan would then be administered, or the risk would be assumed by the insurance carrier. So when you have a Medicare Advantage plan, these are typically network-based, so it's important to find out whether or not the providers, doctors, hospitals, or any facilities that you wish to be seen with the provider, you want to make sure that they're willing to take the insurance or the Medicare Advantage plan that you're choosing, that you're looking into. Some Medicare Advantage plans will require referrals, some will not. Some plans will be an HMO, which is considered a health maintenance organization. Some will be a PPO. So those will be important to take into consideration whether or not your physicians are in network and whether or not you need referrals or whether or not that may pose any hoops to jump through for you. Other nice additional benefits that are included in many Medicare Advantage plans are going to be things like vision, hearing and hearing aid coverage. In some cases, fitness memberships will be included at no additional cost. Some plans and carriers will include things like over-the-counter benefits, where they'll offer you X amount of dollars each quarter or each month to utilize in their catalog, filled with all kinds of different things, household health items like toilet paper, toothpaste, or paper towels, or vitamins, Band-Aids, things like that. So Medicare Advantage plans are designed to be very comprehensive. They're designed to keep your costs down. In a lot of cases, they'll have premiums as low as $0 a month. So depending on what part of the country that you're in, we can absolutely pull up what's available in your area and see. Like you said, lots of Medicare Advantage plans can be very low premium, as low as $0 a month. You will have copays per service as you see physicians and have medical services done. There also may be co-insurances or percentages that you may be required to meet, and a maximum out of pocket or an annual out of pocket maximum, which is a ceiling, which is designed as a protective benefit. So if for some reason somebody had a truly catastrophic year where their copays or their co-insurances were really adding up and they reached that maximum out of pocket, then that person would actually stop paying for any additional major medical services through the end of the calendar year. So it's designed as a protective ceiling. The other piece is Medicare Part D for prescription drug coverage. So it's important to have a prescription drug plan. And what's nice is that with an Advantage plan, in most cases, the Part D or the prescription drug coverage is built in at no additional cost. So whether or not you take prescription drugs, that would be available to you as a member of the plan. So it can be built in, and that way you don't need to purchase or have an additional monthly plan premium for it. So overall, it really is dependent on you, on your lifestyle, on your circumstances, what physicians that you wish to see, and what part of the country that you live in. If you'd like some help kind of navigating through this, I'm more than happy to help. Please feel free to contact me directly. I'm happy to walk you through, answer questions, and make sure that you find an appropriate plan for you. Thanks so much, and we'll see you next time.